Small-town Nebraska hospitals could cut services. New data shows 60% of rural hospitals are losing money. Now they ask lawmakers to help them unlock federal funds.
As Steve White reports, this affects those of us with private insurance. It could bring higher costs for procedures we need and cut services many rely on.
A majority of Nebraska hospitals are running a negative margin.
More patients, less federal funding, and smaller margins. Nebraska hospitals are struggling.
The hospital that's there for your community, the safety net hospital that's open 24/7, 365, doesn't matter if you're uninsured or not, we're here to take care of you.
A large percent of patients are on Medicaid, but federal reimbursements aren't covering the costs. Collectively, the Nebraska Hospital Association says it's a $1 billion shortfall across the state. But Nebraska could increase federal reimbursements by establishing what's called a Medicaid directed payment program.
Where hospitals actually help fund it, but it leverages significant federal dollars that we've been leaving on the table.
Nebraska is one of just 6 states that hasn't taken this step. Hospitals would agree to each put money in with no impact on state tax dollars. That would then unlock more federal funds.
With the numbers that all of our hospitals are seeing, the negative margins growing, we know we have to do something different.
Hospitals say expenses are rising, especially salaries, as they feel pressure to keep staff.
We're in a town of 1,000. You just don't find skilled people.
And those on private insurance pay what one finance director calls a silent tax.
We're kind of at the end of our rope. We've increased radiology and imaging. We've increased outpatient surgical cases to a point where we're not even competitive with outpatient imaging centers.
Plus, they consider cuts to services like labor and delivery and behavioral health, steps they hope to avoid with an influx in federal dollars.
And pulling down these federal monies would make a huge difference for our rural hospital.